Clinical vignette, Puerto Rico medical revalidation style, a 72-year-old male with a history of long-standing hypertension, aortic stenosis and chronic heart failure with preserved ejection fraction HFpEF, presents to the emergency department with progressive dyspnea on exertion, fatigue and occasional dizziness. He denies chest pain but reports orthopnea and paroxysmal nocturnal dyspnea. On examination, BP 180/95 milliterhertz, right, 8 to 85 BPM regular, JD 10 centimeter, babacilla crackles. Cardiac exam, systolic murmur at the right upper sternal border, slow rising carotid pulse. Extremities, 1+ pitting edema. Echocardiogram reveals left ventricular hypertrophy LVH with concentric remodeling, increased left ventricular end systolic volume ESV, elevated left ventricular end diastolic pressure LVDP, decreased stroke volume SV despite preserved ejection fraction. Question: which of the following factors are contributing to this patient's decreased stroke volume SV? Select all that apply. A. Increased afterload due to chronic hypertension. B. Aortic stenosis leading to high left ventricular systolic pressure. C. Increased venous return leading to excessive preload. D. Elevated end systolic volume, ESV, reducing stroke volume.
Answer X, action M.
A. Increased afterload due to chronic hypertension. Chronic hypertension increases systemic vascular resistance, SVR, leading to increased afterload. A higher afterload decreases SVs by making it harder for the left ventricle to eject blood. B. Aortic stenosis leading to high left ventricular systolic pressure. Aortic stenosis increases left ventricular pressure, forcing the heart to work harder to push blood through a narrowed valve. This increases afterload and leads to reduced stroke volume over time.
Such.
C. Increased venous return leading to excessive preload. Increased venous return increases preload end diastolic volume, which initially enhances stroke volume via the Frank-Starling mechanism. However, this patient has HFpEF with stiff ventricles, so excessive preload could worsen symptoms, but is not the primary cause of decreased SV in this case. D. Elevated end systolic volume ESV, reducing stroke volume. Increased afterload prevents the heart from ejecting blood efficiently, leaving more blood in the ventricle at the end of systole. Higher ESV. Since SV equals EDV ESV, a higher ESV results in a lower SV. Correct answers A, B, D. Key takeaways: increased afterload hypertension, aortic stenosis, higher ESV, lower SV. Increased preload, e.g. IV fluids, increases SV only if the ventricle is compliant. Heart failure with preserved EHFpEF means EF can be normal despite low SV.